see right now? Do you see my? I can't see what you see.
Yeah, we see a PowerPoint.
It looks like a PowerPoint.
Okay, awesome. Let me launch this thing here, and let me know if it gets goofy. PowerPoint visible?
Yes.
All right. So this is the history I was given. 63-year-old female, right abdomen, flank pain, long-standing history of seizures and weight loss. And this is in the GU section because I am a GU radiologist. So they showed me these pictures of an ultrasound, trans, long. They've labeled this liver, right kidney, and question mark. And there's some dots of color right here. So they found something. I don't know what that is. And then this is what the CT shows, unenhanced and post-contrast imaging. And in the PowerPoint they sent me, there were little comments that said bilateral exophytic renal masses with central low density. I didn't really buy that. They looked to me like they were perirenal masses. They don't look like they're actually, coming from the kidney, but rather separate from the kidney. So I thought these were perinephric masses. And when they said there was central low density, none of this measures fat. So I'm not sure what that really means, to have some little spots of low density, but they seem to emphasize it for some reason. And I didn't see any fat attenuation. I thought these were extrarenal. And I asked them about this, and because it looked a little weird, but they said that's just bowel, don't worry about that. And there's no nodes anywhere. And then they also gave me a coronal picture of the same deal. And there's a fat plane here, and this was just volume averaging, I think. And then normal adrenal glands. And then I didn't see anything coming out of the nerve roots. And then the skin looked normal to me.
Sounds like you're working up a phakomatosis with some of your pertinent negatives.
That's right. So I have some slides that follow this that have my thoughts on it, but I'm curious what you guys think, if anybody has any brilliant insights as to what this is. I'll show you my insights in a second, or at least my thoughts anyways. These perinephric masses. And again, the history is seizures, and the person is 63, and they have right abdomen pain and a 10-pound weight loss. Long-standing history of seizures.
Seizures is key to the case, I'm sure, but I would be struggling and poring over textbooks myself.
Are there any seizure medications that cause anything?
Pardon, Victoria?
Are there any seizure medications that cause any funny hemoptysis?
So I looked that up, and some seizure medications have been linked to certain kinds of cancers, but then that association was later disproved. And I couldn't find any clear linkage between seizure medications and any kind of tumor formation.
How about anything that causes severe anemia that would maybe cause some weird extrarenal, what do you call it, hematopoiesis?
Yeah, one of the things that could look like this, extramedullary hematopoiesis could look something like this.
Yeah,
maybe something causing severe anemia or bone marrow replacement. Any message of that?
Yeah, I don't know. I don't know of any seizure medications that do that. The bone marrow to me and the bone density look normal. I mean, it's just soft tissue windows, obviously. But yeah, that's a possible thing. We thought about that. Any other thoughts?
On the right kidney on this coronal, there's some part of it that almost looks like it's growing around the kidney. Is that true?
So this is what it looks like on the axial picture. And so I think what this is just some, like, I'm not sure. I see this little piece right here you're talking about.
Yeah.
I'm not totally sure. I mean, I verified with the person who sent it to me that these are perinephric and not coming from the kidney. I mean, it may be that there's a little bit of extension here, possibly, but it doesn't have that classic hairy kidney look, like a classic Erdheim-Chester look.
Yeah.
It seemed more mass-like.
Like I was just saying, my plasmacytoma actually ended up being extrarenal like this, but the bones look fine, so that'd be weird. Lymphoma, I guess you could have had CNS involvement of lymphoma, but they don't give you any of their brain pictures, right?
No brain pictures were given. It wouldn't surprise me if they gave me the brain pictures like on the fly, like at the setting, and then I'll say, I don't know what that is. something in the brain.
And is Erdheim-Chester, do they get seizures?
Yeah, Erdheim-Chester has a CNS association with seizures and I guess random CNS stuff. But usually I think that they have that hairy kidney manifestation where it's just like a rind around the kidneys rather than bulky masses.
This is like juxtarenal.
Well, let me show you what I was thinking on this case, and you guys can tell me what you think. So I thought the ultrasound was very helpful. Renal versus perirenal have a very different differential, so I thought the fact they were perirenal was important. So I kind of stayed away from the renal differentials like tuberous sclerosis for a variety of reasons. You know, the seizures I thought implied a neuro-oncologic syndrome, but I couldn't find one that clearly fit that. And then the fact it's a multi-year process, I thought it was probably not Mets. And I've always thought in these unknown case conferences that guess that mass was a little bit weird because at the end of the day, you know, we're just going to biopsy it. So what's the point in trying to figure out what it is?
You're going to pull a Marta.
What's a Marta?
Marta sat up there and said, in real life, we would just say, get the biopsy, damn it.
Yeah, exactly. That's right. So this is a differential for perirenal things. We had lymphoma, different histiocytosis conditions, plasmacytomas, paragangliomas, extramedullary hematopoiesis, Erdheim-Chester, and then mass-forming IgG4. And then I have little thoughts about these different things. You know, this is a chronic history, so I don't think Mets is a good choice. And I don't think on a film panel someone's going to say that's metastatic disease. This is that question that Victoria brought up. This is a study which looked at epilepsy as a risk factor for cancer, and basically it was a negative study. So I couldn't find a link there. Histiocytosis conditions can have CNS involvement, but nodes are common. I didn't see any nodes in this case. We thought about plasmacytomas, but it seemed like too aggressive for the clinical picture, and the bones look normal. Paragangliomas are common in syndromes. It's a good look for them, but I couldn't figure out what the link would be there. And then extramedullary hematopoiesis, there's no real risk factors for that. Erdheim-Chester usually has that hairy kidney. And then, you know, IgG4 is in every film panel, but I couldn't see any other findings of that. And then here's some neuro-oncologic things that have CNS plus potentially findings around the kidney or in the kidney. NF1, you can get seizures and paragangliomas, but there's no other features of that. TS, there's seizures, but the kidneys are normal, I think. And then VHL, again, this is a perirenal process, not a renal process. There's no seizures in that history. And then there's a bunch of others that I couldn't find one that perfectly fit the presentation. So this was my final differential that I'm working with. A histiocytosis condition like Rosai-Dorfman disease, which is on the spectrum of non-Langerhans cell histiocytosis. And then paragangliomas. You think it's Rosai-Dorfman?
Yeah.
Do they get seizures?
They can get CNS manifestations, and I actually sent the case kind of blind to one of my neuro people, and I said, what's the most likely diagnosis? And he came back with non-Langerhans cell, which is Rosai-Dorfman is under that umbrella. Yeah. So we were kind of both in the same general area. So I think that's a reasonable chance as to what it is. And then my plan would be to get comparisons, look at the CNS, and then do metanephrin testing. So if it is a paraganglioma, I don't hurt the person, then just biopsy it. Do you guys have any other thoughts beyond those things?
I just Googled something because, well, anyway, I found a picture online of something that looks like yours, and it was a renal leiomyoma, which can arise from the capsule. And there is a syndrome where you get hereditary leiomyomatosis, renal cell cancer, seizures, and it's called fumarate hydratase deficiency.
Oh, that's got to be it.
But I'll send you the picture of the leiomyoma that looks very similar to your case.
Yeah, please do.
Actually, maybe I can
share. You're on SMS.
Yeah, just share screen. I'll stop my share.
Well, I can just. Can you see it?
Yeah, a big mass.
Oh yeah.
Yeah, but it looks kind of like heterogeneous, like yours, right? Like.
Yeah.
So anyway, fumarate hydratase.
What did you Google to find fumarate hydratase syndrome?
No, I Googled. How did I end up in this rabbit hole?
Master Googling by Ari.
Oh, I think it was like perirenal mass seizure. And then I just went to images. And a lot of times I'll just look for an image that looks like.
That's what I do too. Good.
All right, I'm going to add fumarate hydratase TACE
Uh-huh.
to the differential list. Thanks.
I'll send you the little links.
RT